So, hello there, my name is Michael Joyce and I am a GP. I currently work with Centric on their innovation and IT team, part of the team supporting and facilitating practices in their use of digital tools to help improve patient care. So in 2016, life was pretty difficult as a GP. We were getting busier and busier. The town was growing, the patient list was growing, and I had the opportunity to move into a new health centre. But the prospect and the thoughts of the increased costs and all the extra work and admin that I was going to have to do was daunting, and I was thinking about what I would do, and I had heard about these Centric people, and I just wondered, maybe would they be an option for me to help out? So I contacted Ray Power and Moss Cox, and I had a meeting with Moss Cox to talk about what Centric were and do, and how they might be able to help. And I have to say that when I met Moss Cox, I was blown away. I thought it sounded fantastic that they would be able to offer me the ability to be a GP, and they would take on board all the administrative, HR, all that side of the business, and allow me just to be a doctor. And so we got into talks, and we came to an agreement, and I went into partnership with Centric Health in 2016, and haven't looked back since. Best decision I ever made. So the support when I joined Centric then was all about them really taking over the reins of the administrative side of the practice. So they took on the HR side, the contracts with the staff, the payroll, the organising the accounts, and doing all the PCRS annual leave and study leave applications, and filling up the STC forms and claiming maternity. All that kind of administrative burden that I used to carry on my own shoulders was all transferred to the Centric support team. When you join, you have a HR support person, and you have a finance support person, and you have a regional manager support person, and there's a full team there available to you to draw on, to talk to get advice from. But ultimately at the end of the day, it allows you to concentrate on looking after patients, which is what we're all about, or what we're all about in this business. And I was able to devote more time to that, to looking after patients. So that's what Centric Support gave me. So what Centric was able to give me, which at the time I suppose I wasn't really fully cognizant of, but Centric encourage you to have, if you have a special interest, they encourage you to indulge in it and progress and get better at it. And I had always had, and many of you might know me from Health One, I always had a very strong interest in the Health One user group and the use of electronic healthcare records to improve patient quality. And Centric are very interested in that as well, and they talked to me and encouraged me to take on a role within Centric doing that. And it allowed me to initially I took a day a week. After a year or two, it expanded to 2 days a week. And now in 2022, I'm actually doing 4 days a week, and I've actually stood back from clinical practice, which is something that, if I'm being honest, is something I always wanted to do, but never thought I'd get the opportunity to do it. And Centric has given me that opportunity, and I'm now working with the Centric IT/innovation team, helping practices with their electronic healthcare records, improving their use of digital tools, improving efficiencies in practices, and ultimately improving patient care through the use of digital tools. And if I hadn't joined Centric and had the support from Centric that they gave me to develop this new role, it would never have happened. And I have to say, I'm very, very happy, very happy. So my interest was as I say, on the IT side. But if I know there aren't too many GPs that are interested in that side of things, but if you have interests in other areas like dermatology or women's health or minor surgery, Centric encourage you and support you to develop these special interests, and will provide you with the opportunity and training and time and stuff to grow and develop your own interests. It's definitely one of their supports that they bring. So I have found the culture of Centric Health to be very much about putting the patient at the centre and looking after the patient's needs, and the support that they provide to us allows us, because we are unburdened, the burden of all the administrative side is taken away from us. It allows us to focus and concentrate our energies on the clinical aspects of our jobs and the support and care of patients. And they back that up also with educational activities, such as we have our subscription to NB Topics, and we have our annual conference, and we have partner meetings, practice meetings, regular communication, clinical policies. There's lots of resources that are made available to us in order for us to be able to deliver care to patients. So the benefits that have accrued to me as a GP and me as a practice, and me as progressing in my career, the benefits from joining Centric have been that I have been given the space and the room to be able to concentrate on the things that I want to concentrate on. With the support that they give through administrative support and HR and finance and all these peripheral things that we were formerly burdened with, we don't have to worry about those anymore. So it allows us, both me as an individual, to concentrate on patient care, but also to give a bit of time to planning for the practice and how the practice will better deliver care, through scope, through making sure the patient sees the right person in the practice, and we have the time to design and plan better care pathways for patients, because we're unburdened from the other things that used to take up all of our time. And then personally, I was able to benefit from the fact that I was able to develop my special interest in electronic healthcare records, and to develop that side of my career. Why did I join Centric? I suppose I joined Centric because let's just say I feared that I was beginning to be burnt out. I could see that I was developing some of the symptoms and I needed help, or I felt I was going to go under. And when I met Moss Cox and heard about Centric and realised that the support that they would be able to provide me with, I thought, wow, this sounds like just what I needed. And I went into partnership with Centric, and it all worked out. My burnout eased. I started to enjoy work again. I began to have time for my other interests, and so I joined because I felt I was going under. I got the support that I was promised, and it worked out. It worked out for me. I think it was a great decision. I'm very happy that I made the decision. If you're out there and you're struggling and you feel that you need help, Centric is definitely an option that's worth considering. Now, of course, there are lots of questions you will have, and you need to talk to them and learn about them and get to understand them. But from my experience, I think that they are a good answer for lots of GPs out there.